The regular insulin, which is injected into the subcutaneous tissue, matches only for the meal, but rather it should be very sustained, or rather it should be prolonged for a period of time. So because the insulin injections will come down if the insulin action is prolonged. But this prolonged action of insulin was tried for a very long period of time. They were trying to put bark, they were trying to inject some spices, there were some gum arabic solution, oil suspension, lecithin emulsions, and also like vasoconstrictors were added to the insulin to prolong the onset of action of regular insulin. But this was not happening for a very long period of time in spite of adding all these things. The first breakthrough came in the form of zinc. When zinc was injected in the insulin, it was able to prolong it was able to stabilize the insulin for a shorter period of time. But that was also not helping for a longer period of time. The ultra-lenti insulins, which were manufactured with the addition of zinc and protamine, they were not stabilized. So because of that, they were having a very erratic absorption and distribution of the insulin, and that is the reason why this lenti and other insulins are not available after 1980s or so. The first breakthrough, even in as early as 1940s it came in, but 1950s we are able to land up with this NPH insulin. The NPH insulin was prepared by adding protamine, which is the antidote of warfarin, as you all know, which was extracted from the sperm of some trout fish, and it was added to this insulin crystals. The actrapid, when it was added with protamine, and which was further stabilized by adding zinc, and the further stabilization came in the form of phenol and cresol were added. So this insulin, which was prepared, which is called as NPH. N stands for neutral, P stands for protamine, H stands for hedgehog. So this NPH insulin, which is universally color coded in the form of green, is the first long-acting insulin. Nowadays we call it as an intermediate acting insulin, but this is the first long-acting insulin which is available for commercial use, came from Hedgehog Laboratories. This insulin, which was developed then 1940s and 1950s, is the same insulin which we are using even now in our clinical practice. So this NPH insulin, the onset typically happens over 1 to 4 hours. So when we inject the insulin, because of phenol, cresol and zinc, the insulin gets clubbed, or crystals. The insulin is available in the form of crystals. So it takes some time for the insulin to get disintegrated to dimers and then to monomers. So because of this reason, it has a delayed onset of action. So since it is available for a prolonged period of time as a crystals, it can have a peak around 6 to 10 hours, and this insulin can act as high as about for 10 to 12 hours also. It can act even up to 16 hours. So the NPH insulin is having such a unique property that it is available even for 16 hours, but not a pure long-acting insulin which works 24 hours. Currently, like nowadays, when we say a long-acting insulin, it has to work for 24 hours. But these insulins act for 10 to 16 hours. The disadvantage of NPH insulin is, one, it peaks at 6 to 10 hours. The other is its duration, that this insulin has to be also given 2 times in a day. So this is the disadvantage of NPH insulin. So we have 2 insulins now. One is the regular insulin, which is available right from 1920s, and the other insulin is the NPH insulin, which is available right from 1940s and 1950s. So these are the 2 basic insulin which we need to remember. All our understanding is going to be based on, one is this regular insulin and the NPH insulin. Now, as we earlier said, the short-acting insulin, it takes some amount of time for it to get disintegrated. So we talked about half an hour, it has to be injected before meal. So it is all because of this aggregation of hexamers which happens, and then it gets disintegrated to dimer and it gets disintegrated to monomer. How good it will be, like we don't let the insulin to club at all, or the insulin which is injected over here, it immediately gets absorbed. So it from hexamer, it immediately goes to dimer and it goes to monomer, or it doesn't go to monomer, it gets absorbed as a monomer at all. It would be very good, no? So the quicker onset of action can be established. So this is what the ultra short acting insulin did. So just if you see over here, the lysine and proline amino acids were changed were reversed to give the insulin Lispro. So there are so many steps which are involved for each insulin. So because of all these steps involved in the manufacturing of short-acting insulin, we are able to manipulate with the amino acid which are available in the insulin, whether by adding, substitution, or by replacing one amino acid with another amino acid. So because of this, we are able to make this insulin to get into the monomeric state quickly, so that the absorption happens immediately. So the absorption is as fast as it is about 10 to 15 minutes, and it peaks exactly in 3 hours. So it means that it exactly mimics the food absorption. So the peak happens in 3 hours and it lasts for 5 hours. So it doesn't act like 6 to 8 hours that it was happening with Actrapid or the regular insulin. So these are the designer insulins which are available now, which is very good for elderly people, type 1 diabetic, and in the GDM people and all. The reason being, even if the patient wants to take the insulin, immediately after taking food, they can take the insulin, so that they can adjust the insulin dose based on what they consume. So these sort of advantages are there with ultra short acting insulin. So this is the era of regular insulin to ultra short acting insulin. There is another regular acting insulin which has come. So we will just name what are all the regular ultra short acting insulin available. They are available in the name of Aspart. There is another insulin by name Lispro. There is another insulin by Glulysin. These are the 3 ultra short acting insulin which are available for commercial use. So regular insulin to ultra short acting insulin, we have 3 insulin. One is Aspart, the other is Lispro, the third is Glulysin. These are the 3 ultra short acting insulin available. Now recently, in these past 2-3 years, we have another ultra short acting insulin in the form of Fiasp. This insulin has vitamin B3 niacinamide, which is added to the solution. It doesn't have it. This is just an Aspart insulin. It is available in the form of Fiasp. They say the absorption is as high as 5 minutes, but there is no big advantage. This is for commercial activity, or for the companies that have lost their patency, and that is the reason they are coming with this new insulin. This insulin, though this niacinamide is added and L-arginine is added, it is as good as Aspart for all practical purpose. You can keep away from this insulin. Nothing much about this insulin you need to know. Just you need to be aware about that there is an insulin which is as good as Aspart.